Hi, I'm Sal DiMercurio. I am the director and founder of Cosmetic Plastic Surgery Center. In this session, we're going to talk about breast augmentation. Breast augmentation can be broken down into either saline or silicone implants. Saline implants have been around for a long time, and saline implants were the most common implants in the early 90s. Silicone implants were around even before saline implants, but were off the market for a few years while studies were being done. Approximately 1,800 studies have been done on silicone implants, and the FDA has found them to be safe. And the type of silicone implants that have developed over the last 20 years have been more cohesive and more gummy bear in nature. The implants look very natural. I can show you a round type of silicone implant and a shaped type of silicone implant. These implants look very similar whether they're saline or silicone, but they feel significantly different when they're silicone. They feel much more natural. You may choose a saline implant if you have a bit of tissue over the implant. In other words, if you have about an inch of your own breast tissue. If you are someone that has lost a lot of breast tissue, or you have very thin amount of breast tissue, then you might want to choose cohesive silicone implants, since they feel a bit more natural and you don't have the same amount of padding over the implant. Choosing an implant is a very personal and very tailored process, which really is something that you'll have to decide after looking and feeling and actually sizing yourself. By the way, you can size yourself at our office. We have sizing systems where you can onlay something that is very similar to an implant and wear some clothing and see if that size would suit you. Placing implants in or under the breast muscle is a very common approach. I prefer a submuscular, subpectoral position that is under the muscle, giving you more padding, giving you a more reliable breast examination when you're doing breast screenings, and gives you an easier mammogram to be evaluated by your radiologist. Certainly, placing them above the muscle is a possibility and has to be done in some situations depending on the shape of the breast. As far as who is a good candidate for a breast implant, the key factor is where the nipple lies with relation to your inframammary fold. The inframammary fold is the area right below the breast. So if the nipple is at or above the inframammary fold, then you would be a candidate for a breast implant. If it is at or below, then most likely you'll require some type of lift in conjunction with the implant. I'll be talking about body lifts, and specifically I'll focus in on breast lifts at the next session. But suffice it to say that if you have a nipple height which is too low, you may not be a candidate for an implant alone. I look forward to having you come in for a consult where we can discuss all these details and tailor them specifically for you.